It was originally scheduled for Wednesday. We moved it to Tuesday at the request of one of our members, and believe we begin all the meetings by reading a script that the town would like us to read. So I ask Cheryl if you wouldn't mind giving us the condensed version of the script.
Sure. Good evening, everybody. This is the Board of Health meeting, and the open meeting is of the Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth and the local state of emergency declared by the Acton Board of Selectmen and the Board of Health due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the virus, the Board of Selectmen have suspended all public gatherings. In accordance with the governor's order, all members of public bodies are allowed and encouraged to participate remotely. The governor's order allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the Board of Health's votes of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment. For this meeting, the Board of Health is convening by Zoom as posted on the meeting agenda's town website calendar, identifying how the public may join. We are now turning to the first item of the agenda, but before we do, permit us to cover some ground rules. The chair will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each by name to provide any comment, questions, or motions. Please hold until your name is called. After members have spoken, the chair will afford public comment as follows. The chair will ask members of the public who wish to speak to identify their names and addresses only after being recognized by the chair, and will be afforded a few minutes for their comment or questions. Okay, I think that's it, Bill.
I think you did a great job. Thank you, Cheryl. And not surprisingly, you're actually first on the agenda to please offer us an update of all of the events that have transpired since our last meeting.
Okay, so as you all know, the governor ordered a requirement of face masks or face coverings in public places where social distancing can't be accomplished. I've included a copy of that order in your board packet. This applies to all workers and customers of businesses and other organizations that are open to the public and permitted to operate as an essential business. In addition to that, I had our building commissioner go out and check some construction sites, and he did that yesterday. And he indicated to me that there's really not a lot going on, and but all places that he visited had proper PPEs and the hand washing stations as required. The governor, I think I might have mentioned this last time, but I thought it was worth a mention because we're going to be discussing this tonight. But the governor also took action to support safety in nursing facilities by increasing funding up to $130 million to allow the facilities to have temporary staffing, testing, and isolation wings. We also are working with the transfer station on a plan to ensure that social distancing and no congregation is happening. So we've put some signage there that should have gone up this afternoon to indicate, separation of 6 feet, wear a mask. We're looking at restructuring the parking spaces to allow the residents dropping off their trash to be able to maintain that 6 feet. It's a little bit more difficult. One of the big concerns that they have with that is, they need to keep the residents off of Route 2 when there's a buildup, especially on a busy weekend day. So we're working on figuring out a way to get a double lane on the entrance into the transfer station. So people are waiting more side by side in their vehicles before they get merged into one lane to get to the area of the transfer station. So I just wanted to mention that we're working on that, and we should have that completed by the end of this week. And the Board of Selectmen, I don't know if Bill, if you want to comment on this, but the Board of Selectmen have put a request to the Board of Health to not restrict parking at the Arboretum and the rail trails. And that's all I have.
All right. Well, thank you,
Oh,
Cheryl.
Actually, one more thing. So on the amended agenda, I put the Board of Health order for appointing the police as agents next. But it would really be great if we could do Heather's update and then have her go directly into the nursing service. So just a thought I wanted to throw out there.
That sounds fine. And regarding the parking at the Arboretum and Rail Trail, Mr. Martin, what's changed? I mean, I think the public health advisory is still the same. What 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 do the selectmen have in mind that the
So
uh,
in our discussion last night, it's the feeling of, well, the resolution passed unanimously. So it's the feeling of really all of us that the squishing people into a smaller and smaller parking area is not helpful in limiting the transmission of the virus. We don't feel that the places like the Arboretum are overcrowded with the amount of parking that's there, and so it's just an advisory to the selectmen, to the Board of Health from the selectmen, that we don't feel that there's a risk there, and that again, squishing the parking into a smaller and smaller area is not really effective.
okay? Well, I'm sure you were part of the original meetings when we were talking about this, and the idea was to limit the attendance at the Arboretum, and that hopefully people would come back later if there wasn't enough parking. Um, and again, it was just to try to keep the distance and keep the groups down. Um, so that would still be the goal. Do you have any? Uh, was there any study like what the occupancy limit of the Arboretum could be and still maintain distancing, or is this just
Well, it was Selectman Charter who made this motion at our meeting last night, and um, I'm forgetting because he brought the numbers that he had witnessed there, and I didn't write them down. That there were maybe a dozen single occupancy cars at the Arboretum for 54 acres, which was hardly an overcrowding situation. Yet in the parking lot, people were kind of crowding. And so that, I mentioned this with regard to NARA at the time we did, the limitations on NARA. I think it's something that the Board of Health should take under advisement. I believe that these, restrictions on people's movements are something that we're going to have to live with for a long time, many months, possibly a year or more. And it's important to be, this is my personal view, to be restrictive in those areas where it makes a real difference. And I think the outside areas and the spacing you find with people walking through the Arboretum or the rail trail is not a big transmission issue. But so it's an advice to the Board of Health. So but it's your guys' call as to what you do. I mentioned some of my reservations originally with regard to NARA when we put in these restrictions.
Okay. Well, thank you. I appreciate the background. Hopefully we're going to be coming at least, I won't say emerging from this crisis soon, but hopefully it'll start to become easier or more bearable. And at that time, I certainly hope that there's some more guidance. There's some more, uh, you know, uh, certainty or science around what this pandemic looks like, and we can be much more um, responsive in terms of trying to limit the burden on the people. Um, but we haven't gotten any updates from the state, and their prime directive at the moment is stay home. Right? That if you're at home, you can't give it to anyone and you can't get it from anyone, and that's very uncomfortable. I realize that, but um, so I guess I would say, for a little while longer, I would um, propose hanging on to the restrictions, but I would open it to comment from members of the board if anyone would like to agree, disagree, comment otherwise.
Yes, I would like to agree, if that's okay.
Well, who are you agreeing with, Dr. Jacoby?
I'm agreeing with David Martin.
Okay.
I go to the rail trail probably 4, 5, 6 days a week. My feeling is there are 2 public lots, one in North Acton, where you've reduced the parking from 20 spots to about 12. There's another one by the train station where you've reduced parking spots from 10 to 5. So instead of, even if you have 2 people in a car, you're going from 40 people maximum to 24 people. Now, when you spread that out over 5 or 6 miles, you can't tell me that really makes a difference. So all that I think we're accomplishing is we're just using some arbitrary power that we have to no ultimate gain. You need people are getting out. Most of the people that get onto the rail trail are not coming from the parking lots. They're coming from the streets. They're coming on bikes. They're coming on skateboards. They're coming from neighborhoods. They're coming from stores. So all that we're doing is just making it difficult for a few people who want to park in the parking lots. It makes no sense. So I totally agree with David. I think we should open up the parking to however many cars can safely fit there. Otherwise, we're just being arbitrary for no reason.
Okay. Well, thank you, Dr. Jacoby. Anyone else care to comment? Mark,
Nope.
I see. Yes.
Yeah, I think that things have not changed. The governor's order is very specific. It says residents are strongly advised to stay home except for essential purposes. Nothing has changed. This still is the governor's order, still the same directive. What we're seeing is it's an advisory and people are not advising. And the overcrowded, it was a problem at NARA, the police and everyone else responded. And we had to take appropriate action when we were advised by the town that they could not enforce it to close it. And you're seeing now a lot of folks are getting out and there's closure of public parks and other areas. The only means to reduce the density is to do that. If people are driving to the facility, they're often coming from other areas. That's what I've observed a number of times where people are coming from other towns, other areas, going out and exploring. People are advised to stay home. If you stay home, you don't spread it. That's the governor's order. That's the directive. That's the issue. So, as we go forward, hopefully things will change, but there's no additional information we've received or guidance that says that should not be the case. So it's very clear that it has reduced the density. And the rail trail is 12 feet wide, 6 feet in each direction. So, maintaining 6 feet means you need to be in a 3-foot lane on the edge of each of it. So there is, is it close contact? Yeah. Is it not for an extended time period? Probably not. But again, it is an issue and it is a concern. And it's not part of the advisory to stay at home.
Okay. Thank you, Mark. Anyone else wish to comment?
Yeah, Bill, I agree with Mark. This is Mike, and I've been very consistent about shutting down areas. I'm going to continue that. I know it's not a popular position with the board, but I just wanted to mention that.
Okay. Thank you, Mike. So, Mr. Martin, I believe there seems to be a general consensus of the Board of Health that we are absolutely sympathetic to the issue. We would very much like to allow people to use the public spaces that are normally available to them, but that this may not be the right time yet. But again, I'll open it. Any other member wish to comment, or should we move on?
Well, I understand. Thank you for your consideration. Again, that I just wanted to relay the feelings of the board of selectmen.
Well,
Yeah,
and I understand your position too, Dave. I mean, you're trying to be responsive and give the citizens the things that they pay taxes for. And
Well, actually, that's not my personal issue. My personal issue is these areas are not a prime area of transmission, and we have created a we've created our own hazard by restricting the parking. So, and we have to live with these things, I believe, for months and maybe over a year. And we need to transition and manage these things safely without undue burden on the public. And I've mentioned before that, considering, Heather brings up on a number of weeks, quite properly, people living in apartment buildings, not to have their kids be in the common areas, because there's no way kids are not going to touch. And that is, prime way of transmitting the virus. And there's no place for them to go. In the hallways or outside of an apartment complex, there's going to be other people. In the town's public spaces, they can spread out. And you cannot expect that you're going to get children to be cooped up in a 3-bedroom apartment for months on end, or 2-bedroom apartment, right? So,
yeah. No,
I think it's a trade-off of risk here. I think the risk is extremely minimal in these outside areas. I go to these areas every day myself. I do not see any risky behavior. People walking on sidewalks, step aside. People walking on paths, step aside. Everybody is very conscious of the restrictions and trying very hard to adhere to them, the spacing.
understood. I mean, I completely understand this is not a long-term solution. Partially, it's the reaction, and I can't tell you that I can quantify the risk. I mean, I hear what you're saying, and you're probably right. But when we ask what is the primary means of transmission, we don't know is the problem. So anyway, well, thank you, Will, for bringing it to our attention and keeping it in front of us, because we do need to do something eventually. I mean, I agree this can't be the long-term solution. So,
Well, thank you, and thank you to everybody on the board for your consideration.
thank you, sir. All right, so moving to the next item on the agenda is actually Heather and the nursing service, and appreciate if you could give us an update, Heather. And thank you again for taking the time to be with us.
Hi, Bill. Good evening, everyone. So my update since we last spoke, there are 100 positive cases within Acton as of this afternoon. 53 of those cases are currently under isolation and being actively monitored during that isolation period. Our staff is doing well with the contact tracing. Everything is going smoothly. I don't see any need at this time to reach out for any additional help through the state contact tracing folks that they have out there. But if we do reach a point that can't be done, we will definitely reach out. As new people are showing positives. Other people are coming off of isolation at the same time. So the number, jogs around, lowers a little, hires a little, but sort of stays in the same bracket. Just a reminder that, we're still getting a lot of calls and a lot of emails looking for information on locations in town of positive cases. And again, I just want to say to the public, we cannot share that information related to privacy. The Mass Department of Public Health does come out once a week with updates on information of positive cases by town. It also comes out with information regarding hospitals, nursing homes, congregate settings, assisted livings, and then deaths by county. So that information is publicly accessible on their website Wednesday afternoons, and it's typically out by 4 p.m. That day seems to be a little bit later, I think, because they're updating all of the charts and graphs that they have. So that's the good point of reference. Bill, is it okay to talk about the nursing home and congregate setting, Robbinsbrook? I know it's on the agenda a couple items away, but I didn't know if you wanted me to mention it now.
Yeah, I think this
Okay.
would be a great time.
Sure. So Life Care, as I mentioned last week when we met, that they were starting to do and had planned on testing for their residents last Monday and Tuesday. So they did test 121 residents, 24 of whom came back with a positive result. In response to that, they isolated per the guidance of having, different sections of the building. So they isolated all of those residents. Any of the residents who were either sharing a bathroom with the positive cases or a roommate of the positive cases, those folks were moved into a quarantine area where they were monitored. And then everyone else is in what they consider a clean area, because of spacing guidelines based on the positives, the isolation, and the quarantine. They did only have 3 of those spaces now. They have stopped taking referrals from other hospitals or rehabs for transfers into the building. That stopped last week. They just felt that they couldn't take those folks in because they didn't have a 4th area for anyone new coming into the building. So the referral sources knew they weren't taking folks, and they're just leaving that as is. During the week, they also tested 91 staff members. I believe they have about 200 staff members. 11 of those are positive. The reason the 109 other staff members or so were not tested was because they showed proof of already being tested within that week, and they were all negative. So they did do that. Per the governor's guidance, I believe it was on the 27th, the day they started doing the testing, there was a mandate that all nursing homes, all assisted livings were mandated to start testing all residents and staff. So they were a little bit before the curve. I know it seems like a high number, but in respect to the other nursing homes within the state, Acton's nursing home only has 19% of the residents that are positive. Most of the state has 50 to 60% of their residents. Some have even more than that. So, as I've said from the beginning, I think they're doing a good job. I think they started things well ahead of other nursing homes. I just feel like they've done a really good job with, how they restructured their cleaning, who could come onto the floors even after the residents, couldn't leave the rooms, after visitors couldn't come in, how they structured the floors so only the staff that had to be on that floor were on that floor. Food service, no one was coming on the floor. It was being left outside the wings. So I think they've done a really, really great job, and they've been very transparent with us. I talked to Christopher Foy at least once a day, if not more than that, either via email or on the telephone. And that includes on Saturday and Sunday, that we both talk and, email each other throughout the weekend. So they've been very, very good about giving us information. Robbinsbrook, at this point, they have also tested all of their residents. They had 4 come back positive. They've also tested all of their staff, and I believe there's 2 positives, possibly a third that doesn't actually work there any longer. They did have a resident test positive in the memory impaired unit over the weekend, and this is the only area of the building where they did not test the residents, only because of the cognitive status of those residents. Honestly, it's at this time when they're that cognitively in decline, it's like testing a child, which they're not suggesting young children are being tested if they don't have to. So they held off doing that, but now that there is 1 positive within that area, they are testing the rest of the residents. The good thing about who this resident is this resident has been confined to a single room with a private caregiver for greater than a month. So no one has been in there other than the 24-hour caregiver that has been taking care of this person. So there hasn't been a lot of interaction with staff, and that includes nursing staff, because the private caregivers there can cue the medications and hand the the nursing staff don't pass meds there anyways, because in Massachusetts, you can't do a med pass within an assisted living. So Carrie LeBlanc and I are, like Chris Foy and I, are in contact at least daily, whether via email or telephone. And again, they've been doing a great job with keeping people out of the building. I'm pretty sure they're not accepting new folks into the building. We had a discussion about that about a week ago, and as of then, they just weren't going to take new folks into the building just related to the virus. And there is an epidemiologist who is assigned to each of those buildings, 2 different EPIs, who have been great with giving information to us also and keeping in touch via email. I think that was it for me.
Well, that's quite a lot, Heather. Thank you very
Sure.
much. I guess I don't have any particular question. The only one we mentioned about if you start to run short of staff, are there any people from the Medical Reserve Corps that could also assist you? Or is that not?
Yeah, I believe Cheryl's shaking her head yes. I
Okay.
believe there's a couple nurses who are looking, to assist if we need it. And I told Cheryl we would absolutely reach out if we needed to.
Okay, so we have some reasonable depth of we have some bench strength, I guess, or however the right metaphor is. All right. Well, thank you very much, Heather. At this point, I'd ask if any members of the board have any questions for either Cheryl or Heather about their reports.
Yeah,
Dr. Taylor.
yeah, I'd just like to make a comment. I think it was in the Boston Globe 2 days ago. They reported that in Massachusetts, 60% of the deaths due to coronavirus have been in nursing home residents. So it's a combination of tight living quarters, a lot of underlying disease, making them more susceptible. So I think having everyone screened puts them ahead of the game. But I did want to refer to the press release on April 27th by the governor talking about COVID-19 nursing facility accountability and support. And they are giving a second round of funding of $130 million for the next 2 months for nursing homes. And one of the requirements was everyone has to test at this point. And Heather mentioned that. But the other thing they're doing is they're setting up an infection control performance improvement center that will be available to all nursing facilities to make sure their infection control is at the top top assistants. And there are probably going to be some performance measures, but I think in terms of the governor's action, not only for nursing facilities, but congregate living situations, has really been excellent, because a lot of it's related to funding. And they're also providing temporary groups, personnel, and crisis management to go into nursing homes and assist them, as well as excellent, teaching facilities about infection control.
Okay. Well, thank you, Dr. Bill.
Doc, could I make a comment?
Yes, please.
Thank you. I appreciate you saying that, Dr. Bill. I didn't mention that in my conversations last week with Life Care specifically. They did have someone from the Mass Department of Public Health come in related to the infection control and the best practice guidelines. So they did have someone who was, doing a educational piece for them to make sure that they have all their ducks in a row. But they also had someone from CMS, who is their surveyor, also doing a survey on the facility itself, based on them finishing and doing all the testing that they started, and based on the results. So they are doing all of those pieces about best practice and infection control.
Okay, very good. Well, thank you. Other members, questions, comments?
Bill?
Mark.
Yes, Heather, thank you so much. We really appreciate all you guys are doing. A couple quick questions for you. One for the nursing home. With such a large percentage, number of residents that are infected, I'm sure a lot of the other residents are very fearful. Are there any behavioral health supports for some of those residents you guys can provide for them or refer to them?
So the epidemiologist who deals with the building, her name is Esther Ray. They manage the oversight because the nursing home is mandated through the state. So she is the main point person. Any assistance that they need in that realm will be handled on the state level. It's not something that we're doing, but the state is, doing all of those pieces for any outside entities that they need assistance with.
Okay. I didn't know if the town social workers or some of the other ones could help support that. That's why I was asking.
Sure. No, and I don't think that the community services coordinator or the senior outreach coordinator have anything going on within those buildings. It's just really the board, us as the nursing service that are doing that right now.
Okay. I'm just thinking that could be a big issue. The other question that came.
Oh, sure.
Looking at this, obviously the trend is challenging and difficult. What about other congregate living or group homes? They're obviously also at risk. Have you reached out to check on any of those for testing and evaluation and support?
So are you talking the small, like Department of Developmental Services homes in town?
Yeah, right. Like the group homes or the ones for like DMH, DDS, or some things like that.
Yep. So I hadn't heard any guidelines related to those homes being mandated to test. It was specifically, I believe, the nursing homes and the assisted livings that I know of. We've dealt with a couple of homes that we've had positive residents who work at the homes, but they're outside of Acton. Mm-hmm. And we haven't heard anything about any outbreaks in the group homes within Acton because they fall under the state themselves. I don't have a list of those. Yeah. I honestly don't know how many are in town. We don't have a purview over that, unfortunately. Yeah. It's a great question, though.
Yeah, there's a number of them, and there have been some in the state that have had to close, and there's been some substantial issues. So I'm thinking where they're at risk in the congregate setting in group homes, it would be definitely worth looking at and trying to protect those folks who are at high risk and high need. So if there's something we can do on that, that would be appreciated. I
Great,
presume,
thank you.
is there anything else that you need from us right now, or we can do to help?
I think we're good right now. The staff has been working, 7 days a week, doing what we do, covering for each other, taking turns over the weekends. The on-call staff are taking calls through our answering service. And if there's anything that they can't answer, they refer to either Linda Cullen and I. So no, it's been going really well. There's snags in the road, as with everything. People hesitant to give answers because they're not sure who they're talking with. So we always direct folks to the website, to go to our, find our phone number, call us back. That's probably the biggest snag that we've had. And I completely understand that with the amount of scams that go on in the world. I think I'd be hesitant to give someone my information without verifying who they were first. So completely understandable, but no, it's been going really well.
All right. Thank you very much. Appreciate it.
See, Mark, I would like to address that last question. On the Wednesday updates, they have a list of all nursing homes, rest homes, and skilled nursing facilities. It's about 8 pages. And they only list people, those facilities that have 2 or more cases. But obviously the rest homes are intermingled there. And it seems to me DPH could easily separate those out and let us know if we have any here. Because they, it's very fine print, 10 pages of nursing homes, rest homes, and
yeah, I've read the list.
Yeah, it goes on and on. So it's hard to disentangle the way they have it, but I'm sure they could provide a search among rest homes and give us the list.
Yeah, I'm talking about group homes, sober homes, other congregate settings. I mean, they're
Yes.
And those have certainly had outbreaks and had closures in other areas in the community. Well, not in the state, not the general community, not the town.
Okay. Well, thank you. Mike, I had seen you unmute there briefly. Do you have a question or comment?
I do. First, Heather, thank you for your work in this and also your team's work in this. And something that has occurred to me going from last time we met, the life care was 2 cases to 24. And during that time, I've lost a lot of sleep on this because I'm kind of wondering if we could have done something better. But there are some practices that I wasn't aware of at these homes. But my first question is, how are you and your staff doing?
We're good. We're just plugging away. Most of our day is spent doing contact tracing, making phone calls to positive cases and cases that are quarantined, to obviously check in to see how everyone's doing. There have been times that we've referred folks to either the emergency room or an urgent care or their PCP just for additional, concerns that we have, making calls to doctors, for some folks. But no, I mean, it's going good, busy, but nothing that's not manageable.
Okay, thanks. I just have 2 other questions. One is about cleaning procedures and at Acton Life Care. There are some CDC guidances for cleaning. Do you know if they're adhering to those guidances?
My understanding they have, they have guidance and guidelines that they have to follow per their regulatory piece that they have through the state to actually be up and running. They get surveyed like every other entity within the state that has, multiple people living within a congregate setting. So they definitely have guidelines. They did change and made those guidelines a little bit more strict when they had the 2 positive cases, where, the guidance that they were following based on everything that's come out, they're following everything, all the updates that come through the pipeline. But they did do additional things in speaking with the state, the Mass Department of Public Health, and the EPI that they had assigned, which the state has been great. That EPI was signed immediately from the get-go of one positive worker who was in the building. It wasn't even a resident. She was assigned when there was a positive worker within the building. So she, in turn, sent all of the additional guidance to them per the CDC guidance and the Mass Department of Public Health guidance. But they also put into effect, changing the way that they cleaned, making it, obviously so, per the guidance, but even before they received the guidance to start doing, they would clean the clean areas and then go from there, and then end with the 2 patients at the time that were positive, and they would end with those rooms at the end of the day, of course, with the cleaning person putting on full PPE. So they've done a good job. When you think about, I know it's a concern because there's 24 people within the building that are positive. I completely understand that. Unfortunately, it is inevitable in a congregate setting to have positive cases, unfortunately. I mean, that's the downfall of living in such a small setting. The flu goes through those places rampantly. The norovirus goes through rampantly. All of those communicable diseases just rush through the building. But if you think about when the other life care in the local area came out with their, I don't even know how many people were positive at the time, but the town of Littleton sent out a letter with their concerns to the Mass Department of Public Health. That was a month ago, so that our facility didn't have positive cases till last week is kind of amazing. But also I'll mention that out of the 24 that were tested and came back positive, immediately when they started transferring people, only 1 person had symptoms. 23 out of the 24 didn't have any symptoms at all. So that to me is a little more concerning, that they weren't having symptoms at all when they were tested, and they came back as positives. So I know
I agree. Yeah.
At it both ways. It's such a hard place to be in this kind of environment with something like COVID-19.
So Heather, I'm just curious, is the reason they were asymptomatic but came back positive, is that because the test was an error, or because they will soon develop symptoms, they just weren't showing them yet?
So they potentially could show sick and be a carrier, as other people, they're finding in the community that there's a large percentage of people that do not have symptoms and have been exposed, and they're potentially, by the contact tracing, carriers of the COVID-19.
Well, this is more just potentially, right? Because they're confirmed to have the virus. So I guess
Right. So, it does take 2 to 14 days from the time you're exposed to come out with symptoms. And that's a huge span. The average time I'd say is about 5 to 6 days that we're seeing, but 2 to 14 days is a lot. 10, I think 9 or 10 days have gone by since they tested everyone, and there aren't 24 people that are showing symptoms.
Do they ever go back and retest the folks that aren't showing symptoms to, confirmation that they really had the virus?
They may. And the same can be said of those folks that tested negative. If they start showing symptoms, I'm pretty positive that they will be testing them again if they haven't already.
Okay.
Heather, did they also check the staff? Were they similarly testing positive and not exhibiting symptoms?
Some of the staff, the staff that I found out about that were tested last week, none of them were symptomatic because they're monitoring their staff beginning a shift, end of shift every day. My understanding is a nurse is doing that assessment. They have to self-identify if they've been in contact with any positive cases, for a contact with face-to-face greater than 15 minutes. And they're also doing they're doing temperatures as part of that assessment, but they go through the whole list that is on the CDC website asking them if they have any of those symptoms. So my guess would be that those employees that were tested on Friday, and 11 of them have come back positive. My guess would be, and I don't know this for a fact, but my assumption would be that none of them were symptomatic if they were there getting tested.
Yeah, that's the concern, especially where the residents obviously are isolated except for the caregivers and other residents.
Correct.
See, Mark, I'd like to comment about, and especially for Mike, the reason it went from 2 to 24 is you're identifying people in the pre-symptomatic stage. And there was a nursing home in Washington State where they've done a lot of studies. They probably had 2/3 of the cases, 2/3 of the residents came down with the disease, and they documented pre-symptomatic spread in nursing homes and recommended that you need to test everyone, because if you just separate the ones that are ill, you'll just get a few more cases exposing more nursing home residents. Now, there haven't been any visitors to these nursing homes, and we know that the patients haven't been leaving. So it's likely that someone who's in a nursing home aide or someone on the staff can bring in an infection, and you have a whole group with a lot of underlying conditions like heart disease, cancer, diabetes, that makes them much more likely to get ill and have a more severe illness.
Okay. Well, thank you, Mike. You had said 2 questions. I think you got in 1 so far.
I did, and Dr. Bill, thank you for that. I actually completely agree with you. But with regards to staff, I actually didn't know that staff was shared between facilities. And as far as I know, Mark asked about what we can do, but Heather, should we consider a order to say that staff shouldn't be shared between facilities?
That's a hard question, because a lot of the staff members within these facilities don't get paid very much and don't have full-time positions at a facility. So to make ends meet, they work at multiple facilities. I've talked extensively with Chris Foy and his nurse manager, Kenny, who I can never remember her last name, about this. And they, as a entity, even their corporate office, they don't feel that they can tell people that they can only work at one facility. When you're the only person working in the household and you're making, slightly above minimum wage. I mean, the aides there don't make a lot of money, unfortunately, and they do the hardest job around for any kind of personal care, or hospital, care. They work their tails off for very little money. So they work at multiple facilities. So that they can't do that, I don't know if we can, I don't know if I would agree that that is something that you all should pursue. That's definitely your decision as the Board of Health, but as a professional who works in, has worked in different facilities, including hospitals and nursing homes and rehabs, I just feel that, these folks don't get paid a lot, and they aren't always full time, and they don't always get insurance through the facilities. That's why they keep them at, you know, under so many hours to give them insurance. That's why they work at so many different places. It's just my opinion. I understand that, working at multiple facilities puts everybody at risk, but how do we stop them from making a living?
Yeah, thanks, Heather. Heather, maybe this is a bigger question than just the Acton Board of Health.
Yeah, but I think Heather had mentioned in a previous one that the folks that were working at multiple sites, if it was within the same company, they were trying to give them enough hours at just one site. I might be misremembering that, but I think at least the facility was aware of it and trying to address it. Well, I'll ask other members of the board questions or comments. If there are none, then Cheryl, is there anyone in the public that has questions or comments for either you or Heather?
I have one, Bill. Calling user number 1.
Tara. Hello, Tara. Please go ahead.
Hi, everybody. I was just going to support Dave Martin way back when, but you didn't ask for comments. Thank you.
Okay, well, I think you got it covered. All right. Well, then, thank you very much, Heather. And I hope we eventually start to see things improve. It sounds like the number of cases outside of the ones in the congregate living facilities, and maybe I'm reading too much into this, but it appears to be slowing down. Was that something you would agree or disagree with?
I think we've been pretty consistent. I know we've had some days that there's been spikes of, 5, 6, 7 new positive cases, and then, a couple of days of 1 or 2. It still fluctuates depending on, I really think, how much testing is going on within the state. Hopefully we'll see, some leveling out pretty soon within the state. And then obviously a downward turn in Acton and throughout the country would be great.
Indeed. I know that report, I think, I believe it was you, Heather, that mentioned it. If not, it was maybe it was Dr. Bill, but no, I'm pretty sure it was you. That lists all the statistics, shows that Emerson Hospital is currently about 45% capacity for COVID. Is that what you're seeing also?
I think they are from what I've seen. I don't know if it was me or if it was Dr. Bill talking specifically about the capacity, but there is, that update on the hospital capacity I think it's on a weekly basis. I don't think it's any more frequently than that, but that 10-page document that Dr. Bill mentioned earlier, that's what's on the DPH website on Wednesdays.
Yeah. So I guess I'm just trying to say, well, in terms of community resources, it seems like, we're certainly busy, but not strained to the breaking point at the moment. And so that's good.
Right.
Okay. All right. Well, if there's no other questions or comments, I'll move to the next item. And thank you very much, Heather. And, like
Thank
I say,
you.
the next item on the agenda is in response to the governor's order recently about masks and requirements that people have masks in certain situations. There was some question as to whether or not the police have the authority to enforce the governor's order. I believe that their general consensus was among communities is that they need to be made agents of the Board of Health for the specific purpose of enforcing the order. So our board member, Mr. Conaby, drafted a proposed order. I don't know if other members have had a chance to read it. I have. I thought it looked very good, and thank you very much, Mark, for jumping in at the last minute and drafting an order for us. But I would like to propose that the board turn their attention to the proposed order and see if it's something that we would be willing to authorize. So, and perhaps maybe I'd ask Cheryl if you could introduce it.
Well, I would like to actually do something else. So about 10 minutes ago, I received notification that we should hold off on this as the town needs to review this further. So I appreciate your last minute attempt to get this on the agenda, but unfortunately, I'd like to recommend that we hold off on this vote this evening.
Okay, could you just, was that on the advice of town council?
Through the town manager, yes.
Okay. All right, well then, I guess that makes, that's fine. We want to do what is proper to support the governor's order so that the town can be consistent with the governor's order. But if the town needs some time to study what's the best way to do that, that I would certainly agree we need to give them the time. There any do members have questions or comments as to what this is about and why we might want to do an order to allow the police officers to be Board of Health agents? Mike, I see you just unmuted.
Yeah, Cheryl, did the town manager give a reason for not proceeding? I mean, I think it's consistent with the governor's order.
Yeah, the only message I received, Mike, was that we need time to review it. So yeah, I think, we want to send it to council and ensure everything before we actually vote this. Our next meeting, I think, is what, Monday, right? I think. Yeah, Monday. So hopefully we can, the Board of Health can, the health department can cover the enforcement aspect until then.
So, and I would just offer, Cheryl, you can pass the word. There's nothing to prevent the police officers from advising people of the governor's order, right?
Okay.
They see people not following it. They can say, pardon me, are you aware that, there is an order to wear a mask in this situation and you should do that?
Okay.
Most people would probably take that seriously, coming from a police officer, and we can follow up with the ability for them to enforce it with citations in a week, as you suggest. Other comments or questions from Mr. Conaby?
I do have a comment. It's not just whether you have a mask on or off. It's only if you're in a situation where you can't distance yourself from others. So
there are some exceptions to that, Dr. Bill.
There are, primarily in grocery stores and pharmacies, probably in liquor stores and gun stores. But basically, the officer would have to make a judgment whether they're in a situation that allows them to be social distancing.
Agreed. And, I like police officers obviously always have to exercise considerable judgment. So, all I'm suggesting is that between now and next Monday, if the police wish to educate the public as to the governor's order, I don't believe they need Board of Health deputization or authorization to do that. And perhaps we could spread that word. Mark?
Can Mark give us an overview and what he thinks of it?
You're asking if I give you an overview of the governor's order?
No, of what you wrote.
Oh, well, I think you're happy to do that. I mean, it came in this afternoon after 5, and the issue of we started researching it, and there seems to be some concerns about how it's authorized and which provisions. And clearly, it seemed that taking the emergency provision aspect of it and relating it to the regulations as well as to the Mass General laws was the appropriate step. If we adopt the order in town, then it can certainly be enforced through the standard mechanisms. So the thought process was to adopt the order and then have the enforcement be this through the standard methods. And then concern about authorized agents to enforce it. I thought it was important that it would not just be the board members, but it would be the health department. And so that's why it was written in the way it was. A couple other points to it. As you mentioned, Dr. Bill, you have liquor stores and other ones. They talk in the order about grocery stores, pharmacy, retail stores. And I think that probably should be a little bit more clarified. And if you're going to enter the premises, and then I also added in the concern that we've had a lot of comments about people at restaurants or food establishments picking up orders. And then it clearly became evident that one of the other big missing pieces was if you're going to enter a public building, such as the police station or the public safety the police station, fire station. You have issues at the transfer station where there's close proximity, where it's not designed to be able to have 6 foot separation with the recycling and things. So those were added. So I see the issue about requesting that order. I would respectfully disagree with, it's going in tomorrow. Having something which can't be enforced is not a good idea. If we want to hold off on having the police do it, I think that's fine. I really don't think that there's any reason we should be waiting for adding those additional other areas, particularly such as municipal properties, police and fire wearing a mask or doing the takeout. But it's that's a decision we can make. We can do it part way, we can do nothing, or we can do it all. It's certainly a bunch of different considerations we can do, but it is clear that under the emergency provisions and laws and regulations, the board has both the authority and indeed the responsibility to take action with this matter.
Can there be something about family units, perhaps? Some kind of exemption, like 4 people sitting on their front porch?
It doesn't apply to personal residence, Bill, Tom. It only talks about public areas, place open to the public. Your facility, such as a residence, would not be open to the public, so it wouldn't apply in that particular case by the reading of what they specifically wrote. Okay,
good. Thank you.
Okay, well, as once again we have a dilemma. It seems that as I was sort of proposing, the governor's order stands by itself. There's a question about how do we empower our local officials, and I think in many cases they can still act, just probably not with the same authority. But I also understand Mark's point of, well, if the governor has issued an order, we need to be able to allow the town to enforce that order. So once again, I'll ask members. I mean, my preference is to wait until next Monday's meeting. I'm not sure, Mark, were you proposing that we adopt the order as written tonight, or were you willing or concluding that it's okay to wait till Monday?
If it's an emergency, it should probably be done expeditiously. Waiting because I have a little concern on, but I think the issue that town council would probably be keying on is the issue of whether to appoint the police officers as agents. I think you could enact this as is without the police being authorized agents. And I think that would be an appropriate first step. And we could work out the other provisions of it by adopting it and adding those other provisions and then making it effective, I think we probably have started the process. I don't really think this is no different than any of the other orders we've done, but I'll defer to other folks' judgment.
Okay, thank you, Mark. Other
You know,
members?
Yeah, I'd like to comment. I think it would be reasonable if we limited it to just the health department staff, and you could just concentrate on the essential. And I like the way you've laid those out, like the grocery store, the pharmacy, the transfer station, that type of place, and get a feel for how many are not going to be wearing masks, because I think it'll be a fair number. One of the things that's interesting about this order is the reason it was a state order is because they had a lot of municipalities that required masks, and the residents would cross from one town to another, and they were causing infractions and they could be fined. And so I think the governor decided they needed to have a common order that applied to the state.
Okay, thank you, Dr. Bill. Other members, comments, questions?
Bill, may I interject?
Yes, please.
So, without knowing what the issue is, I'd be real hesitant to adopt this as written. I appreciate all the work that Mark's done. I'm just wondering if it may be beneficial just to vote the governor's order that I also included in your packet.
Well, I'm not sure we can vote the governor's order unless you're saying we just basically say that, the town of Acton adopts the order as issued by the governor or something like that.
Yeah, whether it be a vote or not, just, that we accept it. I mean, that covers a lot of the face covering. It just doesn't cover the issue with the police being our enforcers, and which I think can clearly wait, because I think we can handle it. My staff is willing and ready to do what needs to be done. So, but I just don't know what the issue is. So I'd be real hesitant to adopt this.
Bill, can you make a suggestion?
Yes, please.
I hear hesitancy, and providing some enforcement mechanism is, I think, part of the issue. We can't have something on the books which can't be enforced. That's just inappropriate. But I think we talked about, to the extent this order should be enforced by the Board of Health and duly authorized agents of the Board of Health, which would be staff. So I think Cheryl's suggesting is, for the time being, I don't know if we can pull up that document to be able to look at it. Is that possible?
It is actually up on the screen right now.
Oh, all right. For some reason, I don't have it on my window being up.
Are you on the Zoom app?
Oh, yeah, I'm on all sorts of stuff. Thank you, David. If you look at the top of the page, it's there. It has the first paragraph. Oh, pull it all the way. There you go. At the top of the page, the Board of Health appoints the sworn officers. That if you delete that paragraph or sentence, actually, and then you delete at the next one, to the extent necessary, you just delete an Acton police officers. I think you've covered that issue of dealing with the police. So that certainly would obviate that issue, and that could certainly be added, because the board can obviously amend an emergency order. And that probably is a good idea at this point if there's concerns about it. I was trying to react to what was recommended to us and to clean it up based on the materials we received after 5 today.
Okay.
Did you follow what I was suggesting deleting or not? Is that clear?
Yeah, that's clear. It strikes out the 2 paragraphs that mention the police.
It strikes out the one paragraph that talks about the police. The second paragraph would stay the same, to the extent necessary or be enforced by the Board of Health or their duly authorized agents. Correct.
Right.
What's highlighted now, an Acton police officer would be stricken. So
that's right.
And I
Yeah.
think the concern is about the board delegating to the police. And I do think that's a reasonable concern. I have no issue with waiting to have town council review that. It's above my
Your responsibilities. Let's just put it that way.
We do so many of these, and you try to react to what people ask, and you draft it, and there's all changes. But the whole idea was to have something to discuss at the meeting where requested action was to happen tonight in anticipation of an order that has to be enforced tomorrow.
Right. Okay. Mike, Joanne, Rika, Tom, comments? How do we want to address this? Hi, Joanne.
Hi. So I agree with Mark's proposal to take out references to the Acton police officers. I hear the hesitancy in Cheryl's voice, and I think until the town manager and or town council feels comfortable with the original order, that we should start with the order with the Board of Health agents or the health department agents for the time being.
Okay, thank you. Mike, do you have a comment, or are you okay?
Just wondering, yeah, thanks, Bill. Cheryl, do you have any idea why the town manager is kind of behind on this order? I mean, it's been known for, I think, over a week at this point.
Well, this order that's in front of you just came out.
Well, yeah, I know, but it came out. I mean, people knew about Governor Baker's order, I think, a week ago. But
I don't think the issue is with the face covering order that the governor has outlined. I just am unsure if it's what Mark's suggesting, that it's the the police officers, or if there's other parts of this order. So we're hoping to be able to review this, and neither town manager or our legal counsel had an opportunity to review this before this evening. So I think it's in our best interest to get that done tomorrow. And if the board's inclined, we can probably call a special meeting in 48 hours if that's what you're looking for. But I just don't know where they're at with this. And it's probably, due to the fact that we tried to get it on. I honestly thought it was something that needed to be done today. So I take blame for trying to push this on for the agenda this evening, but it was probably done a little too quickly. I don't think anybody in the town has any issue with the governor's order.
Yeah, Cheryl, I guess I don't have a problem with what you're doing. I think you're doing a fine job, but town manager, objecting to this tonight, when I mean, who does he think is going to enforce this? I guess is my next question.
Well, like with all the governor's orders, it's all down to the Board of Health. So it's us.
Okay.
And that's why I'm hesitant to do anything on this order, because I believe that the governor's order that goes into effect tomorrow is something that we can enforce. But it's up to you. You're the board.
Yes, and some days that's a difficult position to be in. All right, so at this point, the way we would normally approach this is: does any member wish to make a motion to approve Mark's amended order?
Yeah, I'll make a motion.
All right, very good. Dr. Bill's made a motion. Is there a second?
I'll second it.
All right, Joanne, thank you. We have a motion made and seconded. I'll ask if there's further discussion from members of the board. If not, Cheryl, is there any public comment? You're on mute, Cheryl.
Not seeing any. Yeah, not seeing any.
Okay, very good. In that case, let's vote. Mark, how do you vote?
I vote aye for the revised order, but I would ask that we also put it on the agenda for the next meeting to be reviewed. So if in the interim we need to modify the order, if there's changes, we can do it.
Okay, I think we can certainly do that. So Mark is aye, Joanne,
Aye.
Mike,
Aye.
Dr. Bill,
Aye.
and I'll also vote aye. So motion passes unanimously. Good luck, Cheryl. So you're on camera, so I can see your face.
Yeah, no, I'm smiling. Thank you.
That was, yeah.
Cheryl, I just make one comment. It's like, we throw this at us after 5, you try to deal with it to help the town and, try to provide a mechanism to do it. And it's not my recommendation. We're trying to react to what the folks are being requested of us and to do our responsibility in an emergency situation. So I hope we can convey that back. This is really trying our best to do the best for the town and for the residents and to what we're required to do.
Okay. So I think actually that brings us to the Beaver permit on the agenda, if memory serves, because I didn't print out the agenda.
Yeah. I'm sorry.
No. So, Cheryl, would you mind introducing this item?
Yeah, so I do have the property manager as an attendee who's been probably waiting patiently for this subject matter, but we did receive a request from the Bellows Farm area. There is a outfall structure on the pond that controls the level of the pond. The beavers are blocking that grate. And it's causing the pond to rise. Eventually, that's going to flood into the parking lot, and then some of the residences are actually downgrading from the parking lot. So it hasn't quite hit the level of the parking lot, but it will soon if nothing's done. So under the provisions of the rules, the health department's recommending that the permit be issued for a period of 10 days beginning on May 6th due to flooding of a public or private way and or flooding of residential or commercial buildings.
Okay, very good. I know I think I'd sent you a question, Cheryl. Do they have a licensed trapper prepared to, if they get the permit, to proceed?
So we can ask that if you want me to call on her. I actually had Tom Tidman conduct the inspection while he was in town. So I did not talk to them directly. So unsure.
Okay. All right. Just that's been something we've been looking at because we've run into situations where, people didn't have a trapper and then their permit expired before they could get one and so forth. Any other discussion or questions from members of the board? Okay, seeing none. Any questions from members of the public, Cheryl?
Yeah, so Elizabeth is a property manager, and I'm going to allow her to talk. I do not know how to pronounce her last name.
Good evening.
Hi, how are you? Can you hear me?
Yes, we can. Thank you.
Okay. So it's Kadowski, but I don't fault you for not being able to pronounce it. So we did actually have Beaver Solutions come down to perform an evaluation as well. And their recommendation was actually for us to install a protective flow device. They don't think that trapping is going to long-term resolve the issue for us.
Okay. So I believe actually this permit allows you to do that as well.
Right. I just didn't know if I had to specify whether we were going to remove or install the device. So I just wanted to be clear, just in case.
Okay. Yeah, no, I think you're fine. You're actually the first person that's ever done that, and then to my memory. So, most times it's what we hear is just the opposite of what you just said. That's fine. We're perfectly okay with that. All right, very good. Well, in that case, is there any member who wishes to make a motion to approve the permit?
So moved.
Very good. Thank you, Mike. Is there a second?
I'll second it.
Very good. Thank you, Dr. Bell. We have a motion made and seconded to approve the permit, 10-day permit with a potential 10-day extension. I'll work backwards down the list this time. So Dr. Taylor,
I vote aye.
Mr. Cruz,
Aye.
Ms. Becerra,
Aye.
and Mr. Conaby.
Aye.
And I also vote aye. Motion carries unanimously. Thank you
Thank
all.
you.
Thank you, and sorry to keep you waiting. We had a different agenda for tonight than we'd originally planned. Okay. Again, I apologize, but I believe we've come to the minutes. Is that the next item on the agenda?
Yep.
Very good. I did read the minutes. I have no comments. Do any other members have comments on the minutes? No comments. Anyone care to approve the minutes as written?
So moved.
Thank you, Joanne.
Second.
Mark, thank you. We have motion made and seconded to approve the minutes as written. All those in favor, please say aye. We'll do it by voice vote.
Aye.
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 And I also vote aye. Motion carries unanimously. Very good. We're making progress. I believe that brings us to the end of tonight's agenda. Is that correct? And Mr. Martin, we're relying on you to be our conductor.
Just other updates.
Thank you. Well, I should ask, in fairness, do you have any updates for us that you wish to, as our liaison?
No, I actually think the order you just passed tonight is good. I don't know the reason for the hesitancy. It may be that the select board has to concur in using the police, but I don't know.
Oh, that's a good point.
So,
and then yes, hopefully.
but I'm glad you passed that tonight because I think the text of the order is important nonetheless.
Okay. Well, thank you. So, given that we have no more items on the agenda, I'll ask any members have any final questions or comments. Okay, hearing none. Cheryl, anything from the public?
No, don't see anything.
Very good. Then our next meeting is this coming Monday. I believe this would be a regularly scheduled Board of Health meeting. And but I believe we've reached the end of tonight's business. Anyone wish to adjourn?
Bill, can I ask one more question? Sorry. So apparently, I booked a meeting on Monday, Memorial Day. When I just went through the calendar, I just was picking them. I'm just wondering if I should book that week for the Wednesday?
Yes. Yes, please.
Okay, thank you.
I assume that was not a regular meeting if it was booked on Memorial Day.
No, it wasn't. I just was going through and I completely forgot we had a holiday. So I'll take care of that. Thank you.
Okay, that would be great. Thank you. I just suggest to members of the board that until we get a little further clarity on the state of emergency, that we keep our weekly cadence of having one meeting a week, which we can, of course, if there's nothing urgent, we can pass. And if new situations arise, we can always schedule additional meetings. But the governor's order currently, I believe, expires on May 18th. Is that correct, Cheryl? So presumably sometime after May 18, we should be getting some further guidance from the state. Either the orders are lifted or they're modified, would be my guess, or new orders will be issued.
Hopefully before May 18th.
That would be nice. They cut it a little close the last time, in my opinion. But all right. So I apologize. Anyone wish to make a motion to adjourn? No, we want to keep going.
See, I'll make a motion.
Second.
Very good. Motion is made and seconded. Let's do this by voice. All those in favor of adjourning, please say aye.
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 Uh,
I heard a majority of the members, so we stand adjourned. Thank you again, everyone.
Bill, you're doing a great job.
Well,
Good night.
good night. Take care, everyone.